If you are a medical graduate in India or neighboring Asian countries and thinking to go abroad for your postgraduate residency but completely unaware of the path, of the money required and the time required, then this video is for you. Hey guys, this is Dr. Ashish and welcome back to my channel, The Vital Diaries. Today, let's talk about one of the most common comments I got in my videos about what are the options the MBBS students or the medical graduates have to get the postgraduate residency in the countries like UK, US, Australia, Canada, New Zealand, and UAE. Let's see each countries one by one and which country is best for you. You can decide. Let's start with UK. UK, the usual postgraduate residency training, it is for 3 to 8 years, but they do have some courses for 1 to 2 years like MSc or some clinical research courses which you can do before your postgraduate residency training. In such courses, you will not get paid and you have to bear the expenses on your own. To get the residency match in UK, on an average, for the exam fees, for the visa, for the study material and some coaching, you might need to spend around 15 to 20 lakh in Indian rupees to get the residency match done. It's pretty straightforward path, and first what you have to do is finish your MBBS, then get yourself GMC registered clearing PLAB 1 and PLAB 2 exam and then apply for the residency match. Now let's talk about United States of America. Here again the postgraduate residency years are around 3 to 5 years depending upon the specialty. Usually to apply the residency in US, you have to get your USMLE cleared, you have to get ECFMG certified, which is Educational Commission for Foreign Medical Graduates in US, and then after clearing that, then you have to apply for the residency match. Friends, applying for residency match in US and preparing for it is a costly affair. Usually it costs you around 50 to 60 lakh in Indian rupees. But once you start your residency, you get paid. Now let's talk about Canada. In Canada, the residency years are again 3 to 5 years depending upon the specialty you choose. To prepare the exam, to get the visa, for the study material, for the coaching, you need to spend around 30 to 40 lakh in Indian rupees. The steps is first finish your MBBS, finish your internship, apply for MCC, get registered in MCC, which is Medical Council of Canada, and then you can apply for the residency match. Now let's talk about Australia. In Australia, usually the postgraduate residency program is for 3 to 6 years and you have to get yourself registered for Australian Medical Council. How you can register? You have to create your EPIC portfolio. You have to clear the Australian medical licensing exam and get yourself registered with the Australian Medical Board. After that, you can apply for the medical postgraduate residency training in Australia. Usually you have to spend around 40 to 50 lakh. You have to spend for your exams, your visas, your application fees, your study material and coaching till the time you get the residency match in Australia. Let's talk about New Zealand now. In New Zealand, the residency years are again 3 to 6 years and get yourself registered in the New Zealand Medical Council. They might ask you to have IELTS or English proficiency exams cleared. Once that is cleared, you need to apply for the medical postgraduate residency exam. Usually, considering New Zealand, the cost you need to spend is around 30 to 40 lakh in Indian rupees. Now let's talk about United Arab Emirates. In UAE, the usual residency years are again 3 to 5 years depending upon the specialty. You need to spend around 20 to 25 lakhs in exam preparation, in study material, in applications and getting yourself registered. How you can register yourself in UAE for residency match is first finish your MBBS, do the first 1 year of complete internship rotation. Then you have to get yourself registered in one of the Emirates as DHA, DOH or MOH. Then you have to appear for an exam called as Emory exam, which is Emirates Medical Residency Entrance Exam. Once you clear that exam, then you have to apply for the residency match in UAE. Now, let's see what are the pros and cons if you select any of these countries for your postgraduate match. What are the pros and cons associated with it? Let's go one by one. Now, let's start with UK. The pros of doing your postgraduate residency in UK is the path is actually pretty straightforward and the residency is paid. Usually, they have short academic postgraduate programs like MSc or some clinical research for 1 to 2 years. But the cons are it's a highly competitive exam and you might need a high proficiency in your IELTS score. The processing time is long between PLAB 1 and PLAB 2, and the cost of living in UK is pretty high. Presently, NHS is also not in great shape. Now let's talk about US. The pros are in US you will be doing your postgraduate residency in one of the world's most advanced healthcare system. It's the world's prestigious and well coordinated residency program. You will be working with high exposure of clinical research as well, and the residency is paid in US as well. But the cons are it is a highly competitive exam, plus it is very time consuming. You have a long process to get your USMLE cleared, get the residency match, and as we all know the present H1B visa issues. Sometimes in US residency, they might ask you for a clinical experience in US itself, which you might need to go for your clinical orientation or just clinical experience for 1 year or two in US. Plus, US, most of the places, it's a high cost of living. Now, let's talk about Australia. Australia, as the country is not that big, you will have good work-life balance. You will be working in advanced healthcare system and there will be a good doctor-patient ratio. The salaries in Australia is good, but the cons are limited seats as number of healthcare facilities are less, as well as it is highly competitive, and in Australia there will be high cost of living as well. Now let's talk about Canada. Canada, there is a high standard of care and good hospitals in Canada as well. You will be getting paid very well in your residency and there are chances of getting PR. But the cons is it is highly competitive. There is a long process to get the residency match, and even in Canada, just like US, they might ask you for your clinical experience for an year or two in Canada. As well, the Canada has very harsh weather which you might need to face. Now let's talk about New Zealand. New Zealand is a very simplified licensing system, plus there are really amazing healthcare facilities with advanced technologies you will be doing your postgraduate residency in. There will be good doctor patient ratio and the work life balance will be good. The important thing is you will be having a chance of getting permanently settled there. But the cons are as the country is small, it will have very limited seats and it is highly competitive. The salary is comparatively low than Australia and US. In New Zealand, you might be placed in remote areas to work. Now let's talk about UAE. The pros are it is closer to India and its neighboring countries. It is a fast developing healthcare system with very advanced and well coordinated healthcare system. English speaking in most of the places, it is English speaking. You don't need to learn any additional language to get here in, and the salary or the income you will generate would be absolutely tax free. Now the cons are for these seats mainly locals are preferred first and the rest of the seats are offered to international medical graduates. There might be some countries where the UAE degrees are not recognized, which you have to take care about. So my friends, let's summarize this thing that if at all you have decided to move out of India to get your postgraduate residency match, I would say US and Australia are the best option as of now, and rest all countries you have the idea now you can select. My personal advice would be Still, because I have done residency in India and I know how the healthcare system works, the clinical experience and the clinical knowledge and the patient experience you will get in India is immense, which I don't think so you will get elsewhere. But due to some reasons, if at all you have decided to move abroad, then you can go through this video to get a broad insight into it. If you think this video helped you, then don't forget to like, share and subscribe my channel, The Vital Diaries. This is Dr. Ashish. Thank you for watching my video.